Hi, I'm Dr. William. For over 30 years, I've sat across from thousands of patients, some who were just looking for reassurance and others who walked in feeling perfectly fine, only to leave with a diagnosis that changed their life forever. And here's the unsettling truth. Pancreatic cancer is one of those silent, stealthy killers that rarely shows its face until it's too late. It claims more lives each year than breast cancer and prostate cancer combined, yet few people talk about it. Why? Because the symptoms are so subtle, they're easy to dismiss. But what if I told you that right now, inside your body or the body of someone you love, there could be warning signs quietly brewing, signs that could mean the difference between catching this deadly disease early or finding out when it's already too late. Today, I'm going to walk you through 8 signs of pancreatic cancer that most people overlook. Symptoms that could be staring you in the face and yet completely slipping under the radar. And here's the powerful takeaway. Recognizing just 3 of these symptoms together could boost your chances of early detection by nearly 70%. So as you listen, think about your body, your loved ones, and ask yourself, have you noticed any of these signs lately? If you have, drop a comment below and let me know. Your story could help someone else. And if you find this information valuable, hit the like button and subscribe for more life-changing health insights. Now let's dive in. 1. Swelling of gallbladder or liver. When pancreatic cancer begins to develop, it doesn't just stay confined to the pancreas. It can quietly spread its influence to nearby organs, particularly the gallbladder and liver, 2 vital organs deeply connected to the bile duct. Think of the bile duct as a highway that transports bile from the liver to the small intestine. But when a tumor presses against this duct, it's like a roadblock preventing bile from flowing through its normal path. This obstruction can trigger a chain reaction that's often overlooked. Let's start with the gallbladder. Normally, it's the size of a small pear, tucked away beneath your liver, storing bile until it's needed for digestion. But when bile can't move through the duct, it backs up, causing the gallbladder to swell. This swelling can become so pronounced that it feels like a firm, tender mass right under the right rib cage. It's a warning sign that something deeper is going on. But that's not all. The liver also bears the brunt of this obstruction. As bile continues to accumulate, the liver can become engorged and inflamed, creating a heavy, uncomfortable feeling beneath the ribs. This swelling may go unnoticed at first, but as it worsens, it can be detected through physical examination or imaging tests. Doctors often use CT scans and ultrasounds to clearly visualize these changes. The images can reveal a swollen gallbladder or an enlarged liver, both red flags that could point to an underlying pancreatic tumor. This interconnected system, bile duct, gallbladder, liver, works like a delicate chain. When one link is compromised, the entire system feels the impact. Recognizing these changes early on can be a crucial step in detecting pancreatic cancer before it progresses. 2. Blood clots. Pancreatic cancer is a master at hiding, but it's also a master at setting traps. And one of the most insidious traps it lays is the formation of dangerous blood clots, a complication that most people would never connect to cancer. You see, when we think of cancer, we picture tumors, pain, or weight loss. But few realize that pancreatic cancer can quietly alter the body's clotting mechanism, making blood far more prone to clotting than normal. This condition, known as hypercoagulability, is a silent but deadly effect that can strike without warning. The most common manifestation? Deep vein thrombosis, DVT, clots that form deep within the veins of the legs. At first, it may seem like nothing more than mild leg pain, a bit of swelling, or a reddish-blue discoloration. But beneath that seemingly minor discomfort lurks a hidden danger. If a piece of the clot breaks free, it can travel through the bloodstream to the lungs, causing a pulmonary embolism, PE, a medical emergency that can be fatal within minutes. Now here's the chilling part. Pancreatic cancer doesn't just cause clots by accident. It actively disrupts the body's clotting balance, releasing inflammatory substances that make blood thicker and more likely to form clots. It's a perfect storm, one that can quietly unfold without any warning signs until it's too late. The symptoms of a pulmonary embolism are unmistakable and should never be ignored. Sudden shortness of breath. sharp, stabbing chest pain that intensifies when you take a deep breath, a rapid or irregular heartbeat. These are the red flags that demand immediate emergency care, because when it comes to blood clots, every second counts. Recognizing that an unexplained leg swelling or a sudden bout of breathlessness could be more than just aging or fatigue is a critical step. Understanding the connection between pancreatic cancer and blood clots isn't just about raising awareness, it's about saving lives. 3. Fatigue or physical weakness. Pancreatic cancer doesn't just steal your health, it drains your strength, leaving you feeling as though your body is carrying an invisible weight. This isn't the kind of tiredness you feel after a long day or a sleepless night. It's a deep, relentless exhaustion that clings to you no matter how much you rest. You wake up in the morning, but it feels as though you never slept. Every step is heavy. Every task feels monumental. Inside your body, cancer cells are like thieves, stealing energy and nutrients from healthy cells. Simple activities that once felt effortless, like walking to the kitchen or climbing a few stairs, suddenly feel like climbing a mountain. The body grows weaker, and as the physical fatigue sets in, so does the emotional toll. Sadness, anxiety, and frustration creep in, compounding the exhaustion. But it doesn't end there. Many people with pancreatic cancer also struggle with disturbed sleep. The body's internal rhythms are thrown off balance, making it hard to find real rest. This vicious cycle of sleepless nights and endless fatigue creates a downward spiral that wears down both the body and the mind. What makes this kind of fatigue so dangerous is how easily it can be dismissed. It's often mistaken for stress, aging, or simple overwork. But unlike regular tiredness, this kind of exhaustion doesn't go away with rest. Instead, it grows worse over time, gradually consuming your strength and vitality. Recognizing this persistent, unshakable fatigue could be the warning sign that saves your life. If you or someone you know has been feeling unusually drained for weeks, even months, without explanation, it's time to pay attention. Because when it comes to pancreatic cancer, the signs are often subtle but deadly. 4. Gas or bloating pancreatic cancer has a way of turning everyday digestive sensations into signs of something far more serious. It's not just occasional discomfort. It's a persistent, unsettling feeling of fullness and bloating that doesn't go away. Normally, the pancreas quietly works behind the scenes, producing enzymes that help break down fats, proteins, and carbohydrates, allowing the body to absorb essential nutrients. But when a tumor begins to grow in or near the pancreas, it can disrupt this delicate digestive process, leading to a sense of bloating that many people misinterpret as a common stomach issue. One of the earliest and most noticeable signs? Feeling full after eating just a few bites. Imagine sitting down for a meal you once enjoyed, only to feel uncomfortably bloated halfway through the first few forkfuls. This happens because the growing tumor can press against nearby organs, like the stomach and small intestine, making it harder for food to pass through and causing the abdomen to feel tight and distended. Unlike typical bloating from overeating, the bloating linked to pancreatic cancer is different. It doesn't respond to common remedies like antacids or digestive aids. You could skip meals, drink plenty of water, or even adjust your diet. Yet the bloating remains, a constant, nagging pressure that's impossible to ignore. What's particularly concerning is how easily these symptoms can be dismissed or brushed aside. Many older adults might think it's just age-related digestion issues, stress, or mild indigestion. But when that full bloated feeling lingers for weeks, or when the abdomen appears noticeably swollen despite eating less, it's a sign that something deeper is going on. Recognizing these subtle yet persistent digestive changes can provide a crucial opportunity for early detection, a chance to catch pancreatic cancer before it silently spreads. 5. Dark yellow or brown pee. Your urine is more than just a byproduct. It's a window into your body's health, silently revealing what's happening deep inside. And when it comes to pancreatic cancer, urine color can be one of the first subtle signs that something is wrong. Typically, urine is light yellow, a sign that your body is well hydrated and functioning as it should. But when pancreatic cancer starts affecting the bile duct, that color can darken dramatically. Why? Because the bile duct serves as the main exit route for bilirubin, a yellowish compound that's created when red blood cells break down. Normally, bilirubin passes through the liver and exits the body through stool, giving it its brown color. But when a tumor blocks that duct, bilirubin builds up, unable to escape through its usual path. The liver, overwhelmed by the excess bilirubin, tries to flush it out through the urine instead, turning it dark yellow or brown, similar to the color of cola or strong tea. Now here's what's truly alarming. Many people ignore this change, assuming it's just a sign of dehydration or something they ate. They drink more water, wait for it to clear up, and when it doesn't, they convince themselves it's nothing serious. But if that darkened urine persists for days or even weeks, despite proper hydration, it's a signal that the body is struggling to get rid of excess bilirubin, a sign that the bile duct could be compromised. What makes this symptom particularly important is that it often appears before more obvious signs of jaundice, like yellowing skin or eyes. In other words, it's a silent alarm, one that can easily go unnoticed if you're not paying attention. Recognizing this early warning sign can provide a crucial chance for early intervention, allowing doctors to investigate further and potentially detect pancreatic cancer before it spreads. Don't ignore it. Your body could be trying to tell you something far more serious than just dehydration. 6. Tummy or back pain. Pain is the body's way of sending a distress signal, and when it comes to pancreatic cancer, the location and nature of the pain can reveal crucial clues about what's happening inside. But this isn't just any pain. It's a persistent, deep ache that feels as though it's radiating from the core of your upper abdomen. Imagine a dull, nagging discomfort that starts deep within, just below the rib cage. It's not a sharp stabbing pain. Instead, it feels more like a heavy, constant pressure, as if something is pressing down from the inside. For many, this discomfort doesn't just stay in the belly. It spreads to the back, creating a band-like sensation that wraps around the torso. Now here's where it gets even more unsettling. Unlike typical stomach pain that eases with rest, the pain associated with pancreatic cancer often gets worse after meals or when lying down. That's because as the tumor grows, it presses against nearby structures, including nerves and organs, amplifying the discomfort. Some patients describe it as a gnawing sensation, like a dull, relentless ache that just won't go away. Others say it feels like a weight pressing into the abdomen, a feeling that lingers even after the meal is long over. And as the disease progresses, this pain becomes more intense and harder to ignore. But here's the thing. Not all abdominal or back pain is cancer. However, when that pain is persistent, and especially when it's accompanied by other warning signs like digestive issues or dark urine, it's a red flag that needs to be investigated further. Understanding the pattern and location of this pain can provide critical diagnostic insights. Is it a dull ache that comes and goes? Or is it a constant gnawing sensation that spreads to the back? Pinpointing these details can help doctors distinguish pancreatic cancer from other conditions, potentially catching the disease earlier when treatment is still possible. 7. Fever and shivering. When your body is fighting a hidden battle, it often sends out signals, and fever is one of the loudest. But when it comes to pancreatic cancer, fever isn't just a typical sign of infection. It's a sign of something far more insidious, inflammation deep within the pancreas that many people dismiss as a minor issue. Picture this. You're sitting comfortably, then suddenly you're hit with a wave of intense chills. Your teeth are chattering, your hands are shaking, and you feel as though you're freezing from the inside out. Minutes later, your body temperature spikes, and now you're drenched in sweat, burning up with a fever that seems to come from nowhere. This temperature roller coaster is different from the steady fever caused by a common cold or flu. It's unpredictable and confusing, rising and falling without a clear pattern. Why? Because as the pancreas becomes inflamed, the immune system responds by releasing inflammatory substances, creating a storm of feverish spikes and shivers. But it doesn't stop there. Pancreatic cancer can also obstruct the bile duct, causing bile to back up into the bloodstream. This combination of inflammation and bile buildup creates the perfect breeding ground for temperature fluctuations. Your body is now fighting on multiple fronts: the tumor itself, the blocked bile duct, and the ensuing inflammation. And it's all playing out as recurring bouts of fever and chills. Many people brush this off as a lingering virus or seasonal bug. But unlike viral infections that resolve within a week, These fevers tend to persist or return, often accompanied by night sweats and a gnawing sense of discomfort. The chills, the fever, the sweating, they all come and go, creating a cycle that can last for weeks or even months. If you or someone you love has been experiencing these temperature swings without any clear cause, it's time to pay attention. Because in the context of pancreatic cancer, a fever isn't just a fever. It's a warning sign that something more dangerous is brewing beneath the surface. 8. Digestive problems. When pancreatic cancer begins to silently grow, one of the first systems to feel its impact is the digestive system. The pancreas, though small and tucked away deep in the abdomen, plays a vital role in breaking down food and converting it into essential nutrients. But when a tumor forms, it can disrupt this process in ways that are easy to overlook, but impossible to ignore. Picture this. You sit down to eat, but after just a few bites, you feel uncomfortably full, as though you've eaten an entire meal. That's because as the tumor presses against nearby organs, like the stomach or small intestine, it can interfere with digestion, making food sit longer in the stomach. Over time, this leads to persistent bloating, nausea, and a nagging sense of fullness that doesn't go away, no matter how little you eat. But it doesn't stop there. The pancreas is responsible for producing digestive enzymes that break down fats, proteins, and carbs. When those enzymes are blocked or reduced due to a tumor, the body can no longer absorb nutrients effectively. The result? Unintended weight loss, muscle wasting, and malnutrition. Signs that the body is being starved of vital nutrients even when meals are being eaten. Now here's a telltale sign that many people miss. Changes in stool appearance. When the body can't properly digest fats, the stool becomes pale, greasy, and unusually foul-smelling. It may even float or stick to the toilet bowl, a clear indication that something is preventing the body from absorbing nutrients properly. And here's the danger. These digestive symptoms can be easily brushed off as minor indigestion, aging, or dietary issues. But when they persist for weeks or months, it's a signal that something deeper is wrong, a silent alarm that the pancreas may be compromised. Recognizing these subtle but persistent digestive changes can provide a crucial window for early intervention, potentially catching pancreatic cancer before it spreads. Because when it comes to pancreatic cancer, what seems like a minor digestive issue could be the first sign of something far more serious. Pancreatic cancer is a formidable enemy, but there are ways to strengthen your defenses and lower your risk, starting with some simple lifestyle adjustments. While there's no guaranteed way to prevent this silent killer, making a few intentional changes can create a powerful barrier against its progression. First, let's talk about diet. The pancreas plays a central role in digesting fats, so it's crucial to lighten the load. Swap out heavy, greasy foods for lighter, nutrient-dense options like leafy greens, berries, and lean proteins. These foods not only support pancreatic function, but also reduce inflammation, a known contributor to cancer growth. Next, consider the power of fiber. Adding more fiber to your diet, from sources like whole grains, beans, and vegetables, can help move food smoothly through the digestive tract, preventing the buildup of toxins and reducing stress on the pancreas. But it's not just about what you eat, it's also about how you eat. Eating smaller, more frequent meals can prevent the digestive system from becoming overwhelmed, especially if your pancreas is already struggling to produce enzymes. Now let's move to physical activity. You don't need to become a marathon runner, but making time for 30 minutes of gentle exercise a day, like walking, yoga, or light stretching, can significantly boost circulation, reduce inflammation, and support overall digestive health. Plus, maintaining a healthy weight can ease pressure on the pancreas and reduce the risk of diabetes, a known risk factor for pancreatic cancer. And then there's stress management, a factor that many people overlook. Chronic stress can elevate cortisol levels, leading to inflammation and disrupting pancreatic function. Incorporating mindful practices like deep breathing, meditation, or even a few moments of quiet reflection can calm the nervous system and give your pancreas a much-needed break. Lastly, don't forget about regular health screenings. If you have a family history of pancreatic cancer or other risk factors, annual checkups and diagnostic scans can be a lifeline. Early detection is key, And in some cases, it's the only opportunity to catch pancreatic cancer before it spreads. These lifestyle changes may seem small, but they can create a protective shield, lowering your risk and giving your pancreas the support it needs to keep functioning at its best. Because when it comes to pancreatic cancer, the best defense is a proactive offense. Pancreatic cancer may be silent, but its impact is anything but. It hides behind common symptoms: bloating, fatigue, back pain, signs that are all too easy to dismiss as minor discomforts. But as you've just seen, these aren't ordinary signs. They're your body's silent alarms, trying to tell you something is deeply wrong. By recognizing these subtle yet persistent symptoms, whether it's dark urine, sudden bloating, or a constant sense of exhaustion, you're giving yourself or someone you love a chance to act before it's too late. Because when it comes to pancreatic cancer, time is everything. Time to seek help, time to intervene, time to save a life. If today's video opened your eyes to the hidden signs of pancreatic cancer, imagine what else you could learn to protect your health. Before you go, check out our next video. Seniors, avoid eating eggs with these 6 foods. They can cause inflammation and leg pain. You'll discover the surprising foods that can silently trigger inflammation and joint pain, especially when paired with eggs. It's a must-watch for seniors looking to stay active, pain-free, and independent. Thank you for watching, and remember, your awareness today could mean a healthier tomorrow. Stay informed, stay strong, and keep taking steps toward better health.